Hello everyone. So today we will be going over the pathophysiology behind acid-base imbalances. So if you are struggling with understanding acid-base balances, this video will definitely help you. All right, so first you want to start by understanding what is the role of each player when it comes to acid and base imbalances. So we will break down each player in the slides to come. So what are acids? Acids are the byproduct of the body breaking down fats, carbs, and protein, which then create hydrogen ions. So what are hydrogen ions? Hydrogen ions are acid. So the pH level measures the hydrogen concentration. So your normal pH level should be 7.35 to 7.45. So the more hydrogen ions you have, you are going to be acidic. The least amount or the less amount of hydrogen ions you have, you're going to be alkalonic. All right, so how is hydrogen ions created? So hydrogen ions are created for carbonic acid. So carbonic acid is made from CO2. So when you breathe in CO2 through your lungs, it then binds with the water in your body. So when CO2 and water bind together, it makes this weak acid called carbonic acid. Carbonic acid is a weak acid, so it breaks apart. And when it breaks apart, it breaks into hydrogen ions, and it then breaks into bicarb. So here's a little chemistry structure on the screen, but the important thing to know is when you breathe in CO2, it then binds with water, and then it makes carbonic acid. Carbonic acid is a weak acid, and when it breaks apart, it forms hydrogen ions and bicarb. So we talked about the key player of acids. Now let's talk about another key player, which is a base. So what are bases? So bases are substances that can neutralize your acids. So let's say that you are really acidic, right? You then put a base with it and it can neutralize you out. So this can increase the pH. So remember, if a patient is acidotic, their pH is going to be low, but when the base come into play, it can then bring your pH up. Does that make sense? All right, so we talked about our key players of our acid and our bases, and we talked about the pH. Now let's talk about how the respiratory plays a role in acid-base balance. So our bodies can control how fast or how slow we breathe to affect our CO2 levels. So you're like, Dr. Barnett, why do we want our CO2 levels to be effective? So let's say that your patient is experiencing acidosis, right? So that means that they have a low pH. So your patient who has acidosis, they're going to breathe really fast to blow off that CO2. Why do they want to blow off that CO2? So remember, when we inhale CO2 and it binds with water in our body, and it creates this acid called carbonic acid. Carbonic acid then breaks down into hydrogen ions. So which is an acid, right? So if our patient is acidotic and their pH is already low, we don't want to add any more acids to them, right? So in this patient, they're going to breathe really fast so that you don't have any hydrogen ions or any carbonic acid being produced. So if a patient is acidotic, they're going to breathe really, really fast because they want to exhale all that CO2. Now, if your patient is alkalosis, meaning they're basic, right? So they got a lot of base going on. They don't have that much acid going on. That patient is going to breathe really slowly because they're going to want to hold on to that CO2. So as that patient holds on to that CO2, it's going to bind with the water in their body and it's going to make carbonic acid. Carbonic acid is then going to break down to hydrogen ions, which is an acid, and that's going to cause the pH to be lowered, which is good for this patient because their pH is super high. So hopefully this all makes sense how the respiratory system plays a part. So when your patients are experiencing these different type of whether it be respiratory acidosis or respiratory alkalosis, you will see that the lungs and the respiratory system will kick in pretty fast to try to turn things around. All right, so let's talk about the renal system, and this is our kidneys. So as I mentioned in the previous slide, that your respiratory system, that is going to kick in quick, but your renal system, that's going to take a while for it to try to compensate and help out the body. So if your patient is in an acidotic state, your kidneys will retain bicarb to neutralize the acid, and this will increase the pH. They also can excrete hydrogen ions to increase the pH. If your patient is alkalosis, your kidneys will decrease your bicarb reabsorption, and also they will increase the excretion of your bicarb, and they also can reduce your hydrogen excretion. So your kidneys will try to help out as well, but this would take a little bit longer.